8 minutes. That's how long Dr. Nadia Moreno had to fix her mistake. Not 9 minutes. Not 10. 8. The clock on the operating room wall showed 9:23 a.m. when she realized what she'd done. By 9:31 a.m., her patient would either be alive or dead. Nadia Moreno was one of the best cardiovascular surgeons in the country. 15 years, hundreds of successful operations, awards, recognition. But none of that mattered now, because she had just clamped the wrong vessel, and the bleeding wasn't stopping. Dr. Nadia Moreno didn't look like what people expected. At 38 years old, she was younger than most chief cardiovascular surgeons. Her dark hair, always pulled back in a tight bun, framed an olive-skinned face with high cheekbones and intense brown eyes. Spanish heritage. Her grandparents had immigrated from Andalusia. "You're too young to be a surgeon," patients sometimes said. "You're too emotional to lead," some colleagues whispered. Nadia ignored them. She had learned that 15 years ago. February 14th, 2024. Boston. 15 years since her first surgery. 15 years since a senior surgeon told her, "Women don't belong in cardiothoracic surgery." Too emotional, too weak. That surgeon was wrong. Nadia became one of the youngest female cardiovascular surgeons in the country. Harvard Medical School graduate, top of her residency class, published research, national awards. But she never forgot that comment. Too emotional. Every surgery she proved him wrong. Boston Memorial Hospital, 7:45 a.m. Nadia arrived early, as always. The operating room was quiet. Most of the team hadn't arrived yet. She reviewed the case file on her tablet. Patient, Michael Torres, 65 years old. Diagnosis, abdominal aortic aneurysm, 5.8 centimeters procedure, open surgical repair with synthetic graft placement risk level, high, rupture risk approximately 20% per year. Nadia had performed this surgery dozens of times. It was complex but routine. Clamp the aorta, resect the aneurysm, place the graft, close, 4 to 5 hours usually. Today would be different, but Nadia didn't know that yet. 8:30 a.m. preoperative meeting. Nadia's surgical team gathered in the conference room. Dr. James Rodriguez, assistant surgeon, 34 years old, 5 years working with Nadia. Skilled hands but sometimes nervous under pressure. Dr. Lisa Park, anesthesiologist, 42 years old, Korean-American. Calm, precise, never panicked. Nadia trusted her completely. Maria Santos, lead surgical nurse, 38 years old, Filipina, 15 years of OR experience, knew every instrument, every protocol. Dr. Robert Chen, surgical resident, 28 years old, first year, observing today. "Morning, everyone," Nadia said. "Let's review." She pulled up the CT scan on the screen. The aneurysm was clearly visible, a balloon-like bulge in the abdominal aorta just below the renal arteries. 5.8 centimeters, Nadia said. High rupture risk. Patient declined endovascular repair. He wants open surgery. "Why?" Robert asked. "Better long-term results," James answered. "Endovascular has higher reintervention rates." Nadia nodded. "Correct. We're doing open repair. Standard approach, midline laparotomy, proximal and distal control, then resection and graft." Lisa looked at the patient history. "Any comorbidities?" "Hypertension, controlled with medication," Nadia said. "No diabetes, no kidney disease, healthy otherwise." "Blood availability?" Maria asked. 6 units typed and crossed, Nadia said. "Should be enough." "This is elective, not emergency." Everyone nodded. It seemed straightforward. "Any questions?" Nadia asked. Silence. "Okay, let's meet Mr. Torres, 8:45 a.m. patient room." Michael Torres was sitting up in bed. His wife, Carmen, held his hand. Michael was a retired firefighter, 30 years of service, 3 children, 5 grandchildren. He looked strong, broad shoulders, calloused hands, but his face showed worry. "Dr. Moreno," Michael said, "tell me straight, what are my chances?" Nadia sat down. She always sat when talking to patients, eye level, honest. "The surgery has a 95% success rate," Nadia said. "Complications are rare but possible. Bleeding, infection, damage to surrounding structures. And if we don't operate? The aneurysm will grow. Eventually, It will rupture. If that happens outside the hospital, survival is less than 20%. Carmen's hand tightened on Michael's. So we have no choice. You always have a choice, Nadia said, but I recommend surgery. Michael looked at his wife, then back at Nadia. Okay, let's do it. Nadia stood. I'll see you in the OR. You're in good hands. As she left, she heard Carmen whisper, She's so young. Michael replied, She's the best. But even the best make mistakes. Nadia just didn't know it yet. 9:15 a.m., operating room 3. The room was cold, always kept at 65 degrees Fahrenheit to prevent bacterial growth, bright surgical lights overhead, the rhythmic beep of monitors, the faint smell of antiseptic. Michael Torres lay on the operating table, unconscious, draped in sterile blue surgical sheets, only his abdomen exposed. Nadia stood at the table, gloved and gowned. On her right, James. On her left, Maria with the instrument tray. Across from her, Lisa monitoring anesthesia. Scalpel, Nadia said. Maria placed it in her hand. The weight was familiar, comforting. Nadia made the first incision, a vertical midline cut from just below the sternum to the pubis. Clean, precise. Blood welled up. Maria applied suction. James used retractors to hold the incision open. Deeper, Nadia said. She cut through layers, skin, subcutaneous tissue, fascia, muscle. Each layer required care, precision. 20 minutes later, she reached the peritoneum. The abdominal cavity opened. There it is, James said, the aorta, the body's main artery, normally about 2 centimeters in diameter, but Michael's aorta had a bulge, a balloon. The aneurysm measured 5.8 centimeters, nearly 3 times normal size. The walls looked thin, fragile. One wrong move and it could rupture. Careful now, Nadia said, more to herself than anyone else. She began dissecting around the aneurysm, gently separating it from surrounding tissue. The inferior vena cava on the right, the duodenum on the left. Every millimeter mattered. Vital signs? Nadia asked. Stable, Lisa said. BP 118/76, heart rate 68, SATs 99%. Good. Nadia continued working, 30 minutes of careful dissection. Then she reached the critical moment. I'm going to clamp the aorta, Nadia said. Proximal clamp first. Maria handed her the vascular clamp, a large, heavy instrument with padded jaws. Nadia positioned it above the aneurysm, above the renal arteries, the vessels supplying the kidneys. If she clamped below the renals, the kidneys would lose blood flow. Damage could occur within minutes. Clamping now, she closed the clamp, a solid click. Blood flow stopped above the aneurysm. Proximal control achieved, Nadia said. Now distal. She placed another clamp below the aneurysm. Another click. The aneurysm was now isolated. No blood flow, in or out. Okay, Nadia said. Opening the aneurysm. She picked up surgical scissors, cut into the aneurysm wall, and then... The aneurysm didn't just open, it exploded. A pressurized spray of dark red blood erupted from the incision. Not a trickle, not a flow, a geyser. Blood splattered across Nadia's surgical gown, across the drapes, filled the abdominal cavity within seconds. Bleeding! James shouted. Massive hemorrhage! Nadia's heart slammed against her ribs, but her hands didn't shake. Not yet. Suction, she commanded. Lap pads. Now, Maria moved fast, surgical suction in Nadia's left hand, a stack of surgical sponges in her right. But the blood was too fast. The suction's wet sucking sound filled the room. The canister was filling rapidly. 500 milliliters, 800 milliliters, 1,000 milliliters, over 1 liter of blood in 30 seconds. What happened? James said. His voice was tight, stressed. Why did it rupture? We clamped it. I don't know, Nadia said. She was stuffing lap pads into the cavity, trying to control the bleeding, but blood soaked through immediately. Lisa's voice cut through the chaos. Nadia, blood pressure dropping, 110/65, heart rate climbing, 85 inches. Start giving blood, Nadia said. O negative, 2 units, fast. Already on it. Nadia packed more sponges into the cavity, but she couldn't see anything. Just blood. Dark, thick blood. We need to find the source, Nadia said. I can't see it. It's the aneurysm, James said. No, Nadia said. The aneurysm was clamped. This is coming from somewhere else, but where? Nadia pulled out the blood-soaked sponges, threw them aside, applied suction. For just a moment, maybe 2 seconds, She could see the surgical field. And she saw it. The inferior mesenteric artery. The IMA was a small vessel branching off the aorta, supplying blood to part of the colon. In aneurysm surgery, the IMA often tore when the aneurysm ruptured. "There," Nadia said. "IMA tear. I'm going to clamp it." "You need to be fast," Lisa said. "BP dropping to 95/55. Maria handed Nadia a smaller vascular clamp. Nadia reached into the blood-filled cavity. She couldn't see the vessel. She was working by feel, by memory, by instinct. Her fingers found the IMA, slippery, pulsing. She positioned the clamp, closed it, click, but the bleeding didn't stop. "What?" James said. "Why is it still bleeding?" Nadia felt ice in her chest. The clamp was on. She had felt it close. The IMA should be sealed, but blood kept coming. "I clamped it," Nadia said. "I felt it." "Then why?" "BP 85/50, Lisa interrupted. "Heart rate 110. Nadia, we're losing him." "More blood," Nadia said. "4 more units." Prep the rapid infuser. Her mind was racing. She had clamped the IMA. The bleeding should have stopped, unless it wasn't the IMA, or unless there was a second source. Nadia took a breath, forced herself to slow down, to think. In massive bleeding, panic kills. Panic makes you rush, miss things, make mistakes. She had seconds to figure this out. "James," Nadia said. Her voice was calm now, controlled. "Retract. I need better exposure." James pulled back the retractors. Nadia applied more suction. The blood cleared for a moment, and she looked carefully at the anatomy, the aorta, the clamps, proximal and distal, both secure, the aneurysm, ruptured but clamped off, the IMA clamped. So where was the blood coming from? Then she saw it. Not the IMA, the superior mesenteric artery branch. She had clamped the wrong vessel. Time stopped. In that moment, Nadia's entire career flashed through her mind. 15 years of surgery, hundreds of operations, 0 surgical deaths, until now. She had made a mistake, a simple, stupid, deadly mistake. She had clamped the wrong vessel. The IMA was intact. What she thought was the IMA was actually a branch of the superior mesenteric artery, and the real bleeding source was still open. "BP 70/40, Lisa shouted. "Nadia, patient is crashing." James looked at her, his eyes wide, scared. "Nadia, what do we do?" Nadia felt her hands start to shake, felt sweat dripping into her eyes, felt the weight of 15 years of confidence crumbling. Too emotional, too weak. The words echoed in her head. Michael Torres was dying because of her, his wife, his children, his grandchildren, waiting outside. She had promised them. "You're in good hands," but she had failed. Nadia's jaw clenched. She wasn't going to let him die. Not today. "Lisa," Nadia said. Her voice was steady again, cold, focused. "Give me 5 minutes. Just 5 minutes. Keep him alive." "Nadia, 5 minutes," Nadia commanded. "I can fix this," Lisa nodded. "Okay, 5 minutes, but that's all we have." Nadia turned to James. "I clamped the wrong vessel. The real source is still bleeding." "Then unclamp it. No time, the bleeding would accelerate. I need to find the real source first." "How?" "By looking behind the aorta." James's face went pale. "Behind?" "Nadia, you can't lift the aorta. It's aneurysmal. It could rupture completely." "I know," Nadia said, "but we're out of options." 9:23 a.m. That's when Nadia realized her mistake. 9:31 a.m. That's when Michael Torres would either be alive or dead. 8 minutes. "James, listen carefully," Nadia said. "When I lift the aorta, you're going to see posterior branches, lumbar arteries, small vessels. But if the aneurysm damaged them, they'll be bleeding. And if the aorta ruptures when you lift it, then we pack it and pray." James swallowed hard. "Okay. Maria, I need more clamps, at least 4, small vascular clamps. Ready? Lisa? 3 units of blood in, BP 75/45. Hanging on, barely." Nadia nodded. "Here we go." She placed her hands on either side of the aorta. The aneurysm wall was thin, fragile, like wet tissue paper. If she gripped too hard, it would tear, more bleeding. If she didn't lift it enough, she wouldn't see the source. One chance. Nadia lifted, slowly, gently, millimeter by millimeter. The aorta rose, the aneurysm held, barely, and behind it, "There," Nadia said. 2 lumbar arteries, torn, bleeding. They weren't large vessels, maybe 2 or 3 millimeters in diameter, but they were arterial, high pressure, and they had been bleeding for 5 minutes, into the retroperitoneal space, hidden behind the aorta. No wonder she hadn't seen them. "Clamps," Nadia said. Maria handed her 2 small vascular clamps. Nadia reached behind the aorta. Her hands were in a space she couldn't fully see. She was working by feel again. First lumbar artery. She felt the pulsing, guided the clamp into place. Click, second lumbar artery. Same process, careful, precise, click. "Bleeding slowing," James said. Nadia eased the aorta back down, let it settle. Applied suction again. The blood cleared faster now. The bleeding had stopped. "BP stabilizing," Lisa said. Relief flooded her voice. 80/50, heart rate 115. Still critical, but he's not crashing anymore. Nadia took her first full breath in 5 minutes. "How much time?" she asked. Lisa checked the clock. 7 minutes, from rupture to control. 7 minutes, 7 minutes, not 8. They had made it, but the surgery wasn't over yet. Now came the hard part, fixing everything she had just saved. 9:35 a.m. Michael Torres was stable, but barely. He had lost nearly 3 liters of blood. His blood pressure was low. His heart was working overtime. His kidneys, starved of blood during the crisis, might be damaged, but he was alive. Nadia looked at the surgical field. It was a mess. The aneurysm was still there. 2 lumbar arteries were clamped but needed permanent repair. The wrongly clamped SMA branch needed to be released before the intestines suffered ischemia. And she still needed to place the graft. 2 more hours of surgery, minimum. "Okay," Nadia said. "Let's repair the lumbar arteries first. Suture material, 50-proline. Maria handed her the suture. Nadia worked methodically now. No rushing, no panic. She ligated the first lumbar artery, then the second. Tied them off permanently. No more bleeding. "Good," Nadia said. "Now release the wrong clamp, slowly." James removed the clamp from the SMA branch. Blood flow returned. The intestine pinked up. No damage. "Vital signs?" Nadia asked. "BP climbing," Lisa said. 90/55, heart rate 105, better. Nadia nodded. "Let's place the graft." The next hour was meticulous work. Nadia resected the aneurysm, cut away the damaged balloon section of aorta. Then she prepared the graft, a tube of synthetic material about 2 centimeters in diameter. She sutured one end of the graft to the proximal aorta. Tiny stitches, precise, creating a watertight seal. Then the distal end. More sutures. Finally, she removed the clamps. Blood flowed through the graft. No leaks. "Perfect," James said. Nadia checked everything twice, then a third time. No bleeding, no complications. "We're done," Nadia said. 10:45 a.m. The surgery was complete. Nadia closed the abdomen, layer by layer, muscle, fascia, skin. Lisa read out the final vital signs. BP 110/70, heart rate 82, oxygen saturation 98%, patient stable. Nadia removed her gloves. Her hands were shaking now, not during surgery, only after. "Good work, everyone," she said quietly. Maria squeezed her shoulder. "You saved him, Nadia." But Nadia didn't feel like a hero. She had almost killed him. 11 a.m. surgical waiting room. Carmen Torres stood up when Nadia entered. Her face was pale, terrified. "Doctor?" she whispered. Nadia sat down beside her. "Your husband is alive. The surgery was successful." Carmen's eyes filled with tears. "Thank God. Thank you." "There were complications," Nadia said. She wouldn't lie. "The aneurysm ruptured during surgery. We had significant bleeding, but we controlled it. The graft is in place. Your husband is stable." "Will he recover?" "Yes. He'll need intensive care for a few days, but he should make a full recovery." Carmen hugged her. "Thank you, Dr. Moreno. Thank you." Nadia hugged her back, but inside, she felt hollow. August 2024, Boston Memorial Hospital, surgical conference, monthly morbidity and mortality meeting. All the surgeons gathered to review cases, especially cases with complications. Today, they were reviewing Nadia's case. Chief Surgeon Dr. Robert Hayes stood at the podium. Dr. Moreno's case from February. Michael Torres, abdominal aortic aneurysm repair, significant intraoperative complication. The room was silent. Hayes pulled up the operative report on the screen. Rupture of aneurysm during opening. Massive hemorrhage. Estimated blood loss, 2,800 milliliters, 7 minutes to achieve hemorrhage control. He paused. Dr. Moreno made an error during the case. She initially clamped the wrong vessel, a branch of the superior mesenteric artery instead of the inferior mesenteric artery. Heads turned to look at Nadia. Hayes continued. This error delayed hemorrhage control by approximately 90 seconds. In a massive hemorrhage situation, 90 seconds is significant. Nadia felt her face flush, but she didn't look away. However, Hayes said, Dr. Moreno recognized her error within 2 minutes. She corrected it. She identified the actual bleeding source, posterior lumbar arteries, which had been missed initially because they were behind the aorta. She achieved hemorrhage control. She completed the repair. The patient recovered fully. Hayes looked directly at Nadia. Dr. Moreno, would you like to comment? Nadia stood. Yes. I made a mistake, Nadia said. Her voice was clear, firm. In a moment of stress, I clamped the wrong vessel. I thought it was the IMA. It wasn't. That mistake could have killed my patient. The room was completely silent. But I didn't panic. I stopped. I reassessed. I found the real source, and I corrected my error. She looked around the room. Surgery isn't about being perfect. It's about recognizing problems and solving them, quickly, effectively. I'm not ashamed that I made a mistake. I'm proud that I fixed it. Hayes nodded slowly. That's the lesson here. Errors will happen. What matters is how you respond. He closed the file. Michael Torres is alive, 6 months post-op, no complications. He attended his granddaughter's birthday party last week. The room applauded. But Nadia didn't smile. She just nodded. Because she knew the truth. She had been lucky. Next time she might not be. But next time she'd be ready. Dr. Nadia Moreno still works at Boston Memorial Hospital. She still performs complex cardiovascular surgeries, and she still teaches residents. Mistakes will happen, she tells them. You're human. You'll make errors. But here's what you do. Recognize it, admit it, fix it, fast. That's not weakness. That's strength. That's surgery.